Chair.
Okay, I think we're live on YouTube.
Okay, good morning, and want to welcome everyone on visiting us on YouTube. This is the first meeting of the Joint Committee of Children, Youth, and Families. We're just going to give a couple minutes for people to kind of log on. We are a interim committee that meets and focuses on issues of children, youth, and families. The topics that we cover are covered in a number of our standing committees, but our focus is specifically here for children, youth, and family. We have a very robust agenda, so my opening remarks are going to be brief. I'm State Senator Mary Washington. I represent the 43rd District in Baltimore City. I want to have an opportunity to introduce my co-chair, and actually I'm going to ask each of our members if you would just introduce yourselves quickly, just who you are, maybe your committees and what you represent, and if there's any leadership positions that you'd like to share. So I could start with my co-chair, Delegate Ariana Kelly, who represents District 16.
Oh, thanks. Thanks, Senator Washington. Hi, very briefly, happy to be here. Glad we're back. Looking forward to doing some interesting work this interim. Please forgive me if you see my video go off. I have taken on another job as a 7th grade special education teacher from home. So I am doing that while also doing this.
We're all double dipping. So why don't we start? I'll alternate between our senators and our delegates. I'll start with Delegate Senator Benson, if you're on. Let's see. I don't see Senator Benson yet. Oh, okay. How about Senator Eckert? You could just press the space bar and that should unmute you.
Or click on the mute to unmute it.
Or do that. Or we could start with, there we go.
Thank you. Sorry about that. I had no anything to click on, so it's a crazy day. Senator Addie Eckert, I cover the Midshore, all of Talbot, Caroline, Dorchester, and Wycomico. Very much concerned about services for children, youth, and families, and making sure that what we have in the law is consistent with what we're doing in practice, and then making sure our kids are safe and educated and moving along as they should be. So thanks so much for your interest in these initiatives. Thank you.
Thank you, Senator. Delegate Atterbury.
Thank you, Senator Washington. Good morning, Delegate Ariana Kelly. Good morning, everyone. I'm Delegate Vanessa Atterbury, Vice Chair of the Judiciary Committee. I represent District 13 in Howard County, and I'm interested in all things related to children, as I have an 8-year-old, a 7-year-old, and a soon-to-be 6-year-old. So thank you all for being here this morning.
Thank you. Senator Griffith.
Thank you, Madam Chair. Good morning again, everyone. I am Melanie Griffith. I have the pleasure of representing District 25, which is Central and Southern Prince George's County. I serve with many of my colleagues who are on this call on the Budget and Tax Committee, where I chair the Subcommittee on Health and Human Services. And I too am very interested. While my children are not as young as Delegate Atterbury's, I do have 2 sons, one who is an educator in Prince George's Public Schools, and the other who's working very hard in private industry. So it's my pleasure to be a part of this work.
Thank you. And thank you for being a member of this committee and joining this committee. Delegate Ebersol.
That bar thing is awesome, Madam Chair. I was worried to try and it worked perfectly. Delegate Eric Ebersol. I serve in the Ways and Means Committee. I also chair the Early Childhood Subcommittee, which deals a lot with education and special ed issues there. We are currently wrestling with child care for or daycare for school-age children who suddenly need it. It's a brand new issue for us, and we're working very hard with it, but I'm happy to be on this committee too and hear all the issues that we're dealing with and perhaps some of those.
Great. Senator Heddleman.
Good morning, Madam Chairs. Thanks so much. I'm Shelley Heddleman from District 11 in Baltimore County, and been in the Senate for about 5 minutes and happy to join this joint committee. So thanks for having this meeting this morning.
Okay, thank you. I don't see Senator, do I see Senator Kipke is on? I do see Delegate Rose. My former colleague in Ways and Means, I think. Okay. Okay, we will go, I know Delegate Rose is here, but so we will go on to Senator King.
Good morning, everyone. I'm Senator King from District 39 in Montgomery County. I'm also the Senate Majority Leader, and I have been in the Senate for a lot of years. In all of those years, I've focused on a lot on education and early childhood issues. So I've been on this committee for a long time and happy to be here this morning.
Great. And Senator, I see Alonso, I don't see. Okay, I see Senator Stallings. Senator, put your hand on the space bar. You have to unmute yourself.
Oh, got it.
There
Can
we
you hear me
go.
now? Oh, okay, thank you. Thank you. So I'm Senator Stallings for Baltimore County. Really was looking forward to this and be a part of this. I've been working with some of our new community leaders with CAN and some of our people that I know are going through some tough times right now, as we all are through our state and nation, to help out our communities in every way. So I'm just looking forward to learning more about this, to be a new part of this. And I just want to thank you for this opportunity.
And welcome to the committee. I see you're a new member. I'm excited that you're here. We both are. And again, Senator Sidnor.
For some reason, this spacebar thing doesn't want to work for me.
Oh well.
It didn't work for me either.
Okay, all right then.
Good.
They're just technically challenged. It worked.
It's sometime with me. No, but good morning, Senator Charles Sidnor from District 44. If Senator Heddleman's been in the Senate for 5 minutes, I've been in the Senate for about 5.5 minutes. But I represent Baltimore's city in Baltimore County, and this is also my first meeting with the joint committee. So I look forward to working with all of you. A number of you who've been my colleagues over in the House and some of my new colleagues in the Senate. So thank you.
Great. Thank you. I think I hit everybody that's here. So again, we'll just jump into it. We have a full agenda. First, we're going to hear a summary of proposed and enacted legislation that are related to children, youth, and families that occurred during the 2020 session. That report will be provided to us by our analysts, Ms. Wagner and Ms. Wetzik. Then we're going to get a briefing on the Children and Youth Division under the Governor's Office of Crime and Prevention, Youth and Victim Services. As you know, this is a new shift for this office to move, this division to move into this office. So we're looking forward to hearing about that and asking questions about that change. And then, of course, for the folks that are literally on the front lines that are providing the services, particularly under COVID, so our local management boards, and we're going to hear from a lot of them, a range across the state of Maryland. Globally, we'll get a presentation from the chair, but then we're going to hear from specific local management boards about what's going on. And then we're going to have an overview of our local care teams. We're very concerned and interested on a number of initiatives. And finally, we will get a briefing from our Youth Services Bureau. So again, it's a full agenda. This is a very important mission that we have. It was important prior to COVID, but even more so. Just a few housekeeping items. Ensure that your cameras are turned on. Please mute yourselves, of course. If you have questions, raise your hand. We have staff use the little function in the front there where you can raise your hand, in the chat, or feel free to jump in. I think, handle it how we normally do as much as possible. And again, we're focusing on our local management board's activities. Let's go. So I'm going to start first. Well, actually, if you don't mind, I've been wanting to start these with quotes. Well, a quote that's been shared to me or suggested that we might want to jump on this would be, we need to ask the moral questions. Do I have a right to be content living in a world with so much poverty and inequality? These questions motivate us to view the issue of inequality as central to the core of our humanity. I say that is that in light of so much that's been going on, issues of equality, but also equity are really important. So as we hear our presentations, we want to make sure that we're focused on those issues. So let's just start with our staff, Ann Wagner and Emily Wetzik.
Thank you, Madam Chair. I think we'll just get the PowerPoint.
You can do that.
Set up,
I should give you a little more lead time. So get that going. There we go.
Can everyone see the PowerPoint slides?
And if you want to make it a little easier for folks, if you use the speaker view, that way you can get rid of the grid and just see who's speaking, see Ann, and then just see the PowerPoint. Okay, thank you.
Great. All right. So as the chair said, my name is Ann Wagner with the Department of Legislative Services, and I serve as staff to this committee along with Emily Wezek. So today we'll be providing a brief summary of the bills from last session impacting children, youth, and families, especially bills related to social services, childcare, and long-term care. And just as a caveat, this is by no means all of the bills that relate to the committee's issue areas, but in the interest of time, we'll go over this selection of bills. And after we present, there will be an opportunity if any members want to summarize or comment on any other bills we didn't include here, that would be welcome for just a few moments. So then moving to the next slide. I'll first cover enacted legislation. So to begin, Senate Bill 207 and House Bill 206 took effect on July 1st of this year, and they were recommended by the work group to study shelter and supportive services for unaccompanied homeless minors. This legislation authorizes unaccompanied minors in need of shelter to consent to these services as long as the provider reasonably believes that the shelter is necessary to ensure the minor's safety and that the minor understands what is being offered and can provide informed consent. The bill also establishes requirements that the service providers register with the Department of Housing and Community Development and implement a procedure for background checks on any staff members that work with minors before they can start serving minors. Next slide, please. Senate Bill 367 and House Bill 277 also took effect July 1st of this year, and they require the Maryland State Department of Education to develop guidelines to assist schools in administering a trauma-informed policy. So this is defined as a method for understanding and responding to an individual. This includes students, teachers, and staff members who show signs of chronic interpersonal trauma or traumatic stress. Next slide, please. Senate Bill 455 and House Bill 547 will take effect October 1st of this year. And these bills establish a new program under the Department of Health called the Maryland Children's Service Animal Program. This program refers children with a history of trauma, with PTSD, or who are diagnosed with a developmental disability to be referred to a nonprofit that will match them with a service or support dog or a therapy horse as appropriate. The program will be supported by the fund created through this bill of the same name, and this is a special fund made up of private donations and any other funding allocated in the state budget. Next slide, please. So this begins the proposed legislation that was not enacted. The first bill here is Senate Bill 453 and House Bill 374. These bills would have required the Behavioral Health Administration under the Department of Health to keep an updated list of services that are available to children in Maryland that have a mental disorder. The list would have been categorized by type of service, and the list would have included services available to children enrolled in Medicaid. Next slide, please. Senate Bill 624 and House Bill 1140 would have required the Department of Health and the Governor's Commission to study mental and behavioral health in Maryland to develop a comprehensive mobile response and stabilization system for children and families. The department and the commission would have been required to study existing mobile response efforts and then submit their findings and recommendations to the Finance and Health and Government Operations Committees. Next slide, please. Senate Bill 637 would have codified the Therapeutic Childcare Program, and this is a program that supports specialized childcare and early childhood education for children under 6 years old who have developmental delays or physical disabilities. The bill would have changed the funding for this program to be a per pupil funding formula, and it would have included a mandate that not less than $45,000 is appropriated per child beginning in fiscal 22. Next slide, please. Senate Bill 662 and House Bill 986 would have required the Department of Human Services to report more information to the General Assembly on child and foster youth. And so this included pieces of information like the health and mental health care provided to these youth, as well as a lot of other pieces of information. MSDE would have also been required to report more information, including the number of children with individualized education plans, the rate of absenteeism and suspension and dropout rates among these youth, along with other information. Next slide, please. Senate Bill 690 would have required the Department of Health to develop and publish materials to assist Maryland residents with long-term care family planning by January 1st of 2021. So these materials would have been required to be consistent with the task force on long-term care planning's final recommendations, including that the materials show contact information for organizations that can help with long-term care family planning, as well as providing these materials in English and Spanish and other languages as necessary. Next slide, please. Senate Bill 828 and House Bill 1135 would have been an emergency bill that required MSDE to submit certain waiver requests on behalf of free summer food service program sponsors in Maryland. So this is a federal program, and MSD would have been submitting waiver requests to waive some of these sponsors from certain federal requirements, specifically site visit requirements and certain mealtime requirements. Next slide, please. Senate Bill 863 and House Bill 1091 would have increased the personal needs allowance that the Department of Health uses to determine how much a Medicaid recipient who is aged, blind, or disabled has available to contribute to their medical costs. So by increasing the personal needs allowance, this would have led to Medicaid paying significantly more for long-term care costs, as the recipients are seen as having less allowable income to contribute themselves. And there was a proposed amendment to this bill from the sponsor, and that would have made this bill only apply to adult daycare services specifically, rather than all long-term care services and supports. On the next slide, Senate Bill 918 would have established a commission on trauma-informed care as an independent office in the Department of Human Services. And next, Emily will describe the next group of proposed bills.
Okay, so the next bills are Senate Bill 940 and House Bill 1020, which would have required the Maryland Department of Health before July 1, 2021 to implement a health services initiative that would have provided to eligible public school students vision screenings, eye examinations, and eyeglasses. It would have also required the department to, again, before July 1, 2021, apply to the Centers for Medicare and Medicaid Services for an amendment to the state health plan in order to implement that initiative. Senate Bill 944 and House Bill 989 would have required a hospital prior to the discharge of an infant to provide both verbal and written instructions to the infant's parents or legal guardians about how to care for the infant at home, including providing a safe sleeping environment, avoiding shaken baby syndrome, and coping with the stress of having a newborn infant. Before discharge, a hospital would also have to ask the parent or legal guardian if they can provide a safe sleep environment, and if they could not, the hospital would provide resources on obtaining the equipment they would need to do that. And then finally, the parent would have to sign a form confirming that they understood the instructions and information provided by the hospital. Senate Bill 965 and House Bill 584 would have required the Department of Health to reimburse a medical daycare provider for a full day of care when the provider was unable to provide 4 hours of the required 4 hours of care, either because of a weather-related closure or because of a medical emergency experienced by a participant at the center. Senate Bill 981 and House Bill 977 would have established a work group to study long-term care, Medicaid eligibility, and payments to providers. The work group would have had to identify, compile information on, and study various aspects of that subject, and would have had to make recommendations on 10 different issues related to that subject as well. Senate Bill 1018 and House Bill 1386 would have required regulations adopted by the State Board of Education on child care centers to do two things. One, establish qualifications for child care teachers that would allow an individual who holds certain degrees to qualify as a child care lead teacher if the individual successfully completes certain training within 6 months of being hired. And then two, require each child care center employee to complete specified training within 90 days of hire. It would have also required MSDE to review and then either approve or deny applications for employment at a child care center within 14 days of receiving the application. House Bill 396 would have required MSDE by January 1st, 2021 to establish guidelines for early childhood developmental screenings for children under the age of 3, to assess the child's progress through foundational early childhood development milestones, and also to screen for potential disabilities. And then by July 1st, 2021, each child care center must offer to the parent or guardian of each child in their care under the age of 3 an evaluation of the child using those MSDE guidelines. House Bill 666 would have established the work group on screening related to adverse childhood experiences. The work group had 4 tasks: to develop screening tools that primary care providers can use to identify and treat minors that have mental health disorder related to an adverse childhood experience, provide those screening tools to the Department of Health, recommend changes to the physical examination form that MSDE requires for each new public school student, and then finally study and make recommendations on actions that primary care providers should take if after a screening the provider finds that the minor has trauma related to an adverse childhood experience. And then by July 1st, 2021, the work group would have reported its findings and recommendations. House Bill 878 would have established the Family Connects Home Visiting Pilot Program in Prince George's County. The program would have provided, improved, and studied the effects of home visiting services for eligible households in the county. Beginning fiscal year 2022, the state budget would have included an appropriation of $100,000 to the Prince George's County Department of Family Services to implement the program. And then the county would have reported on the program by December 1st, 2025, and the program would have terminated on June 30th, 2025. House Bill 1382 would have established new restrictions and procedures regarding children in out-of-home placements and their admission to or retrieval from medical facilities. For example, the bill would have provided prohibited a local Department of Social Services from failing to remove a child from a hospital or other facilities under certain circumstances. It would have also created a foster children support fund and a task force to examine the placement of foster children in emergency departments. House Bill 1468 would have made it unlawful for a parent or guardian who is notified by a public school of their child's violent or disruptive behavior to fail to seek and participate in counseling with the child. And then if convicted, the parent or guardian may be ordered by the court to perform community service. A public school would also have been required to provide written notice to the parent guardian of a child who engaged in 2 or more incidents of violent or disruptive behavior, either at school or at a school activity during the school year. House Bill 1550 would have required family child care providers and child care centers to provide notice to parents and guardians of each child receiving care at the center of a report or incident of suspected child abuse or neglect on the premises. It would have also required the designee of the state superintendent of schools to ensure that that notice is provided either by the provider themselves or by the designee. And then the bill establishes a civil penalty of no more than $500 per violation. House Bill 1555 would have made changes to the child care subsidy program, including by altering the eligibility requirements, altering how long certain children are eligible, and establishing maximum co-payment amounts. It would have also renamed the program the Child Care Scholarship Program. So that is the end of our presentation. I don't know if anyone has any questions or if anyone wanted to comment on any of these bills.
Thank you. Thank you so much. And I should have said this at the beginning. Delegate Kelly and I alternate who leads each meeting, so I'm not just taking over. So just for flow, we're taking turns. So it's my turn to do the meeting. So that's a lot of content, and there's a lot of bills. Colleagues, we're going to make sure we send the list of those bills. Does anyone have any burning desires or questions about the bills? Otherwise, we could follow up and have a conversation later about them. And again, if you have any questions, I'll just peek and look at the participant list. Okay, great. All righty. Well, thank you both so much for doing that. I guess I do have a question. Perhaps could you also look and see if anything has been pre-filed? Maybe, and let us know, of course, not today, but maybe between now and the next meeting, we can see if there are any pre-files so we can sort of get ahead of seeing what people are contemplating in our area. So
we'll definitely monitor that.
Okay, great. Thank you so much. Okay, next we will get our briefing on Children Youth Division under the Governor's Office of Crime Prevention, Youth and Victim Services. And so we have Mr. Fuston with us.
Yes, we do.
It's great to see you. Do you have a PowerPoint, or are you speaking to us directly?
I believe there is a PowerPoint that they can bring up for us.
Opportunity. We'll talk a little bit. Hey, they're fast. There it is.
I know. It's amazing, huh?
All right. Thank you. Let's get started.
Great. Well, first, I want to thank everybody for having us here, especially Chairs Washington and Kelly, but the entire committee. It's a great opportunity to be able to talk about the great work our office is doing. But on a side note, I did want to invite Senator Washington to all of my Zoom meetings for the tips and tricks section to help us with how to use Zoom, because it's very good tips for me, at least. So I certainly appreciate that. Our office has been doing a lot of good work, and with us, I have Jessica Wheeler, who serves as our Deputy Director of the Children and Youth Division, and Kim Lott, also, who's the Assistant Deputy Director of the Children and Youth Division. And I just wanted to give you first just a very quick overview of our office as a whole, because as you know, it has changed. It's the Governor's Office of Crime Prevention, Youth and Victim Services. And we are certainly focused on a multidisciplinary approach. And if we can move to the next slide there. Or do I move it to the next slide? There we go. And I think this does a great job of kind of representing what our office is focusing on. And what we're looking at is not just one part of the solution, but we want to look at three different, very distinct areas as we move through our work. And we're working in the world of law enforcement and criminal justice, but not just working with law enforcement partners. We're obviously also working with the Justice Reinvestment Act, and we're working at that at the adult level as well as at the youth and children level as well. We have our victim services unit as well that allows us to focus on those that have been victimized by crime and violent crime throughout the state, both the adult and children. And then more specifically, our Children and Youth Division, which is the Legacy Governor's Office for Children, where we're looking to improve general well-being. I think one of the things that's important to point out when we're working at these is we do our best, and it's something that we talk about on a regular basis, not to look at each of these as individual silos, but how do they work together? How do we look at the criminal justice system as a whole, as it relates to the victim services or the victims of the state of Maryland, as it relates to children, youth, and really their entire family, how they all come together. And our office for years has been known as the State Administrating Office. And with that, we get federal and state dollars that come into our office, and we administer the grants from those programs. And I think that's what a lot of people see from our office. But I think at the same time, what we have highlighted in our office, and because of the changes that Governor Hogan has made, we're also able to plan, promote, and fund these programs and work alongside of partners in the field. I think you're going to hear from some of our partners coming up on how we're working together in order to implement solutions. And in a lot of cases, I turn to them as the experts in the field. I think that Pam Brown's going to speak a little bit later, and I think that the work that we're doing with our local management boards and our youth service bureaus across the state is very impressive, and I'm glad to be a partner in that process. What we're doing on the other side of the coin of bringing the funding in, what we're trying to do is show that that's only a small piece of what we're trying to do. Again, we're trying to build the collaboration and then use that funding in order to support that collaboration. But we're also building out our ability to utilize data in order to better understand what our problems are in the community, listening to our community certainly, but also utilizing the data to better understand what those problems are, then develop programs with experts in the community that are evidence-based and are proven to have an impact, and then monitor our progress. So we have a very robust process in place where we're monitoring our grants. So we're seeing that we're moving the needle through time. And what we're trying to do is also stabilize the programming so the funding isn't going up and down as much. We're stabilizing that funding so that we can continue to push on the same flywheel, so to speak, in order to improve the well-being of children and families in our community. So with that, some of the notable changes that our office has gone through in the last couple of years, which you may be familiar with, is in 2018, we transitioned the Sexual Assault Reimbursement Unit out of the Maryland Department of Health. That has now come into our office. We brought the Criminal Injuries Compensation Board into our office in order to create the Victim Services Unit. So now these victim services are all combined in one place where we can sit down and talk with victims and also hear their holistic need of what they need. We also brought the Governor's Office of Children into our office, which you guys are all aware of. We just talked about that and how we're moving on that. And then we also moved to a fiscally independent agency for more transparency on our budget, which was something that the legislature wanted us to do, and we've successfully done that. It was a fun process, I'll say. I hope you can see the smile on my face. That was it was a definitely interesting process, but I think it was a well worth process. It's really giving us the opportunity to focus on these three different areas, which I think sometimes have looked at as independent entities: criminal justice, victim services, children and youth. And by bringing it all together into one whole, we're able to see that as a constant motion and how they all interplay with one another. And I think Jessica and Kim will talk about that a little bit more detail. Jessica is going to give you a more specific overview of the actual Children and Youth Division.
Great, thanks, Glenn. Good morning, everyone. As Glenn mentioned, my name is Jessica Wheeler, and I serve as the Deputy Director of the office's Children and Youth Division. I've been with the office for a little over 12 years now in a number of different capacities focused on our work for young people in Maryland, and I really appreciate the opportunity to present to you today. So the efforts of the Children and Youth Division are focused on improving the well-being of children and youth across the state. To accomplish this, we support programs and services that reduce adverse childhood experiences, coordinate services, and support needs identified by our partners at the local level. Strong partnerships have allowed us to expand the knowledge and use of trauma-informed practices in Maryland. You'll hear a little bit from them later on in the meeting. For instance, we've worked with the Maryland Children's Alliance to increase the number of accredited child advocacy centers across the state from 10 in 2016 to 16 in 2020. We've also provided funding to support programs such as the Boys and Girls Clubs, the Choice Program at UMBC, and the Police Athletic Leagues, which provide youth with mentorship opportunities, as well as positive youth development programming. Next slide. So I wanted to highlight a program that our office is implementing to address childhood trauma and adverse childhood experiences. Handle with Care was originally developed in West Virginia as a response to the opioid epidemic. Washington County was the first to implement the program in Maryland. And in 2018, Governor Hogan announced that we would launch the program statewide, and our office was tasked with managing the statewide implementation. I've provided a data overview on this slide and also provided a link to our dashboard where you can find real-time data by jurisdiction. And as you can see on the slide, since 2018, we have launched Handle with Care in 16 Maryland jurisdictions with over 760 schools participating. 2,300 notices have been sent from law enforcement to schools, reaching 2,825 students. And these notices have resulted in 211 referrals for in-school mental health services and 29 referrals to community-based mental health providers. Next slide. As I mentioned earlier, one of our top priorities is fostering interagency partnerships and collaboration. With the transition of GOC into the office, we have worked to employ Maryland's nationally recognized Children's Cabinet model to strengthen partnerships between state agencies so that the state can provide coordinated and comprehensive programs and services to meet the needs of young people. The Cabinet now meets on a monthly basis and is chaired by our Executive Director, Glenn Fuston. Next slide. An integral part of advancing our goals to improve the well-being of children in the state is our work with the local management boards that serve children, youth, and families in Maryland's 24 jurisdictions. In fiscal year 20, we administered over $18 million to address the 7 funding priorities, which are outlined on my next slide. And we approved budget modifications totaling $596,366 for 19 local management boards to address their COVID-19 needs. In addition, we provided $138,761 in additional funding to 6 local management boards to address their COVID-19 needs. Next slide. We really rely heavily on the local management board's expertise and local knowledge of their community's needs and work in partnership with them to address those needs. And I can't stress that enough. It truly is a partnership. Whether their priorities are related from childhood hunger to trauma. And I've just listed here what the current priorities are, and you'll note that 2 were recently added in 2019, addressing adverse childhood experiences, as well as increasing opportunities for diversion from the juvenile justice system. Next slide. So in addition to funding, the division also dedicates staff and resources to provide training and technical assistance to the local management boards. We host a monthly meeting with the local management boards as an opportunity to share information, learn about emerging trends, and troubleshoot barriers and challenges. Additionally, during the COVID-19 pandemic, we have been having bi-weekly calls with the Lmb representatives from each region and the state. And these calls have truly been instrumental in coordinating resources such as PPE, and just staying abreast of the local efforts that are underway and coordinating where we can. Also, Lmbs are now applying for funding through the office's grants management system, which our partners have found to be more efficient and less burdensome than the previous process used by the former Governor's Office for Children. Next slide. As Executive Director Houston mentioned earlier, our office makes decisions based on data and outcomes. To support this, the division continues to utilize the results-based accountability framework, which helps us move ideas to action. The Lmbs are required to utilize this framework for their Children's Cabinet interagency funded programs and services, with the exception of their planning efforts. Our office also coordinates training opportunities on the framework for the Lmbs at no cost to them. We also provide licenses to the scorecard where each Lmb enters their data. Next slide. The Children's Cabinet also provides support for a local care team coordinator position, which is housed within each Lmb. In fiscal year 21, the Cabinet agencies contributed $1.8 million to support these positions. Local care team coordinators are experienced professionals responsible for ensuring a coordinated system for local care team case referral and tracking, maintaining a resource database, and ensuring follow-up services for youth with intensive needs. I know that the Lmbs here today will be providing more specific information about local care teams, but I wanted to provide you with a sense of some of the statewide data points from fiscal year 20. So on this slide, you'll see data from July 1st, 2019 through December 31st, 2019. As you can see, the local care teams reviewed 377 cases in that time period. 57.6 of the youth referred for in-state residential placement were served through community-based services. And 67.6% of the new youth referred for out-of-state placement were served through in-state community-based services or in-state residential placements. Next slide. So in addition to managing the Children's Cabinet, the division is also responsible for ensuring the state's compliance with the Federal Juvenile Justice and Delinquency Prevention Act, as well as the Federal Children's Justice Act. So both of these acts require maintenance of a council, which the division facilitates to ensure the mandates are met. The overall goal of the Juvenile Justice and Delinquency Prevention Act is to strengthen the state's juvenile justice system. Through this, we fund diversion and community-based programs and services as alternatives to confinement, as well as address racial and ethnic disparities in the juvenile justice system. The goal of the Children's Justice Act Committee, which is within the Child Abuse Prevention Treatment Act, or CAPTA, is to improve the administrative, judicial, and investigative handling of child abuse and neglect. Through this, we support programs such as child advocacy centers and multidisciplinary teams, as well as court-appointed special advocates, just to name a few examples. Next slide. The division also provides staff support to a number of boards, councils, and committees, which are highlighted here. Our responsibility is to ensure the groups are maintained in alignment with their legislative authority and are moving towards their goals and outcomes. We also utilize these groups as forums to vet new ideas or seek feedback on strategies. And several of the groups that we staff also assist with reviewing grant applications that the office receives and makes funding recommendations to our office for consideration. Next slide. So this concludes my presentation, and we'd be happy to answer any questions that you may have. And again, thank you so much for your time this morning.
Mr. Houston, is that it? Any other comments on this?
No comments on us. Just thank you very much, and looking forward to any questions you have, and then also working with all of you.
Okay, great. I'm sure my colleagues have questions, and I think I'll just, while people are figuring out how to do that. Great.
Might I ask a question?
Yes, I got you. Yes, Senator Sindor.
Within on your slides, there was I guess something about some, it looked like a budget cut, 16, it said, I think 16 plus down from fiscal year 2020, from 18. Could you speak a little bit more on that?
Yes, so as a result of the COVID impact, we had to reduce the budgets to the Lmbs by approximately 10%. Just recently, what we did, I think, is work with the Lmbs wherever we could to make that as best as possible, meaning we gave them the flexibility to decide where that funding was going to be moved from, but that was a result of COVID.
Thank you for that. Well, I think we'll follow up more on that with our LMBs about exactly where those cuts happen and the impact to services. So thank you for that. But are there other questions? Other colleagues have questions? So again, use the, if you can't figure out how to use, feel free to just jump in. Okay, I guess I could ask while we're waiting. Can you comment on why we've seen, or are there out-of-home placements continue to increase, and what actions you're taking in coordination with the local management boards?
Certainly. I think Jessica can dig into the details of the increase or decrease in that. But I know from the Children's Cabinet standpoint, we've actually increased the frequency in which the Children's Cabinet is meeting. We used to meet on a quarterly basis, and now we're meeting monthly in order to address that. And that's one of our top priorities that we're working on the Children's Cabinet. And what we've done is we've brought in several different agencies to talk about how we can work to reduce that placement issue. And it's certainly a high priority. Jessica, do you have specifics on the numbers?
I don't have the data in front of me, but I can say that, as Glenn mentioned, the Children's Cabinet is certainly coordinating around this. I've been involved with the Children's Cabinet for many years now, and this has sort of been an issue of interest, and I can say that they're very involved in looking at this. And we're also, I mentioned briefly about the local care teams. And they really, the cabinet supports those local care team coordinators and sees that as one tool to assist to ensure that we're serving youth in state when at all possible. And so those are, that's it's being looked at, as Glenn mentioned, and I think that the local care teams, and you'll hear more about that later, can really support that effort.
Great, and it's specifically, if you could provide us with the allocations and the data, just the funding allocations that's being targeted towards the addressing out-of-home placements, I think that would be really helpful for us. So I appreciate that. Any other questions? And I guess, okay, I see a big one. Someone just shared it. How has the move from GOC, a formerly independent agency, changed Children, Youth, and Families Division or policy priorities? So they want to know, have you become more crime focused?
Right. Yeah. And I know that was a big concern when the move happened. And again, I would leave that for Pam and for the others to give you their perspective. From our perspective, we did add 2 additional priorities, as Jessica mentioned, to the priority list. And one of them did deal with juvenile justice diversion. But other than that, the priorities remain the same. So we're looking at the impact of incarceration, disconnected youth, childhood hunger, youth homelessness, trauma and adverse childhood experiences, which was the other one that we added, and then the diversion, as we talked about it. So I don't believe that it's changed as greatly as people thought it might to the criminal justice world. Again, we're looking at the holistic side and the wellness of the children.
Great, thank you. And I think the other comment that I see here is about the public health component. Taking it out of public health, kind of let's make sure. I think it makes sense, like having this interaction, this interdisciplinary approach. But the committee is very interested in making sure that we remain focused on children, youth, and families as a whole. So.
100%. And the Department of Health is a part of the Children's Cabinet, and obviously we work with them greatly. And then again, through the local management boards with their connection to the local health departments, we're still maintaining that focus.
Great, thank you. It's important work. I said Senator Heddleman has a question.
Thank you, Madam Chair. I just wanted to know if your budget priorities will be changing at all, reflecting the current struggles that many youth are dealing with and the mental health issues that many young people who are confined to their homes, not able to mix and mingle with people their own age, are struggling with now.
Certainly, that is something that we're looking at as a whole. Obviously, I can't speak to the budget specifically, where the governor will go with that at this point. But I know from our office's standpoint, what we're looking at is how is this remote learning, this disconnection from community going to impact our children long term? And it's something that we've talked about with the Children's Cabinet. It's something we've talked internally, and we are looking for grant opportunities that we can make available to address that issue. So it's certainly on our radar.
Okay, thank you. Thank you. Thank you so much. We'll move on. Again, we have a packed agenda, but we'll follow up with you and continue to look forward to working close with you leading up to the next session and as we make our recommendations. So thank you very much.
Sounds great. Thank you all.
Next, let's hear from our local management boards. Today we have Pamela Brown, the chair of the Maryland Association of Local Management Boards. She's also Anne Arundel County Partnership for Children, Youth, and Families. Then we'll hear from Damon Millard here from Baltimore City, President and CEO of our Family League, Nancy Shockley, and then Kim Eisenreich. And then finally, Mr. Elijah Wheeler. So we've got a lot, and I'm assuming our presentations are about 5-7 minutes apiece, but we've got a nice group of folks. We will hold all of our questions to the end of the panel and then have a robust discussion, I hope. So thank you, Ms. Brown.
Good morning, senators, delegates. It's always a delight to be here with you talking about my favorite subject, the Maryland Local Management Boards. Next slide, please. As most of you know, local management boards have been around in Maryland for 30 years. It's probably in the last 3 years that they've really created quite a stir at the national level. There's been a real look at how you create holistic services and a holistic response out of a health and human services system that you all know is extremely fractured. And the way that Maryland did that so many years ago, 30 years ago, was to create a children's cabinet at the state level and then have that echoed in every jurisdiction in the state of Maryland to really create a cross-system approach and a cross-conversation. So we can go to the next slide, please. As you know, every county and jurisdiction in Maryland has a local management board. And really, that in itself is a perfect form. The Brookings Institute and the senior economic policy person there, whose name is Stuart Butler, is fascinated by local management boards and has now written 3 articles about them. And in his last one, basically said every state in the nation should create a children's cabinet with local management boards, because that's really the only way to make a good system out of what has basically been set up as a very fractured system and not helpful to families. So moving along, next slide, please. What do? Well, we respond to local needs. We're like you, we're like delegates and senators. We're basically local entities. We convene a table of all of the different child serving agencies along with residents and families, family members, to try and understand what's going on at the local level. And then to try and figure out where the gaps are at the local level, and then try to come in and fill those gaps as best we can. And so our coordination of services is probably one of the most important things we do, but we also fund very grassroots neighborhood organizations at the neighborhood level, and that's important. And let me just make the point that children and youth do not exist outside their families or their neighborhoods. You cannot really serve children without really serving their families and understanding what's happening in each neighborhood. I think local care teams, which I will talk about a bit later, are a really excellent example of a coordinated approach to children and families. Moving along. One of the neat things about Lmbs is we're small and nimble, and we're really good at responding quickly. So when COVID hit back in March, we were absolutely straight on it. What are we going to do? What's going to be the worst things first, and how quickly can we start coordinating resources? Many of us started with food, and you can see all the things that we did and are continuing to do. We've organized food pantries, free meal kits, weekend meal backpacks, breakfast, lunches, worked with restaurants and volunteers to deliver hot meals. Because although our school system has done an absolutely fantastic job serving children, their families needed food too. Many families lost employment during this period of time. The Latinx community have been horrifically impacted. They have the more cases than any other. The African American community have had more deaths than any other. All of those disparities are shown in COVID, a great big light. COVID shone a light on all of the inequity in all of our areas across the nation. And so the other piece that was happening, all of these things were real before, guys. None of these things suddenly occurred in COVID. We had hungry families. We had families without transportation. What happened with COVID is it multiplied. And every local management board in the state knew that was going to happen. And that's why we jumped on it. And these are examples. We've provided school buses to deliver meals. We've funded mobile meals. And we've become the Amazon of Maryland. We have delivered anything you can think of in the last 3 months, from Chromebooks to food, to medical supplies, to clothing, to baby supplies. My staff have delivered, and I know every local management board in the state has too. If you start adding up the numbers, it is incredible. Just in Anne Arundel County, we just hit 120,000 pantry meals coordinated by my local management board here. Next slide, please. Resources. So it's not just about food, it's not just about transportation, but all of the other things I was talking about. So we have coordinated the response in each county with all sorts of public information. We've also distributed things that are not available either through extra food stamps or food supplies, things like people were desperate for baby supplies, hygiene products, cleaning products. Can you imagine families with no cleaning products in the worst neighborhoods impacted by a pandemic, and they've got no cleaning products? They also didn't have any masks. So many of us went out, and we're still delivering masks in low-income communities. We've delivered food to COVID positive families with no transportation, Spanish speaking, having absolutely no resources at all. And we have bought and delivered Chromebooks for all at the beginning, before the, and I will say that the school systems across the state have really got their act together. But in that first month, everybody was trying to move huge systems. Local management boards are not huge systems. We were on it and we were doing it. Mental health. Honestly, mental health we talk about as the second pandemic of COVID. And if you think about it, it was bound to happen. We had already, long before COVID started, we'd already seen the huge increase in mental health issues for our young children. Add a pandemic to that, families stuck in together, poor, low-income people, no jobs, no food, kids who can't play with one another. It's a perfect storm for mental health. We have focused on trauma, we've focused on mental health services, and we've continued to maintain our care teams, which we'll talk about later, which have actually transferred beautifully to a virtual platform. Next, please. Here's our historical funding. You know, I always talk about this. We were at 46 million in 2005. Believe me, the cost of living hasn't got any less. In 2021, we are now at 16 million. That was another drop from the 2020 amount of 18 million. And moving along, please. So what's the impact of that? I think that when we make these cuts, it's easy to say, oh, there's that weird 18 million stuck out there. I'm not sure what that's doing. Whether that would do a 10% off that and it won't really be noticed. Well, frankly, it's noticed in huge amounts in every local area because much of it goes to serve families and children in all the ways I've talked about. We lost 43 programs completely removed, 1,000 children and more impacted by cuts. Reduce the administrative capacity for Lmbs. That's probably the least of our issues, although frankly, we're getting pretty thin on the ground at this point. Positions cut completely in local management boards. Cuts in important strategies like race equity. Just think about this. With the backdrop of a pandemic and the sorts of racial issues we have in our community at the moment, here's the types of programs we've lost. Strengthening families. Best evidence program I know of around substance use and families. Career pathways, mediation in jails, school-based mental health, after-school programs, healthy families, youth employment, mediation at the jails, parental bonding. I don't have to hit you over the head with this, guys. This is what happens when you do a 10% cut. That's what happens. Next. So I am now going to hand over to my dear friend, Damon in Baltimore City, who can give you some real examples of what we've been doing during COVID. Sorry, Damon, I nearly carried on there.
Not a problem.
Thank you.
We know how passionate you are, Pam. Good morning, Madam Chairs. Damon Millard, representing Family League of Baltimore, the city's local management board. Very briefly, I'm going to just touch on some key highlights just in terms of which we had to shift into during the global pandemic. As Pam had mentioned earlier, the most immediate need was the increase that we saw in the area of food insecurity. And so we participated as a part of the citywide emergency meals food task force in really examining kind of the gaps within the food distribution system. As a part of that, we actually had to submit an application to the Maryland State Department of Education and actually make an expedited request to shift into summer food service programs. Why did we do that? This was to allow us to provide meals in a non-congregate setting and also providing an opportunity for participants to receive meals in a grab-and-go model in maintaining social distancing, which was critically important. We were able to achieve that and provided meals within 20 meal sites throughout the city, which included roughly around 114,000 breakfasts and lunch, as well as 118,000 snacks in supper. That also included us providing that level of service and support within 8 of the city's public housing projects within the city of Baltimore. So we were appreciative of MSDE and being able to turn that around in a very quick and fairly fast pace. One of the key aspects that was also referenced was the issues as it relates to trauma and also post-traumatic stress, in which a number of our service providers have been experiencing. Not only does Family League as a local management board provide the level of support in terms of grant making, but we also provide professional development as well as technical assistance to all of our funded partners as a part of our network. All of that had to switch to a virtual framework, in which we were also making sure that we were mindful in providing mental health supports for those public service and human service providers. As a part of the budget modifications that we had to quickly deploy and make within our fiscal year 20 budget, I want to thank the Children and Youth Division for providing that level of support, in which we were able to work with the Mayor's Office of Employment Development and hire approximately 30 young people who are providing the level of support at the distribution centers for providing the meals in the communities that I had mentioned earlier. These were young people who were considered to be at risk of being opportunity youth. Some folks call them squeegee youth. I like to call them intersection entrepreneurs. It was 30 of them who provided that level of support for 5 days a week, 6 hours a day during an 8-week setting. So we were really appreciative that we were able to make that happen. Also, in terms of providing personal protection equipment for a lot of the frontline workers, who are really deep in the trenches, providing that access to support for families. We were able to make sure that we were able to, help not only in terms of securing, but also the distribution of masks, wipes, as well as respective, all the supports that was needed for those families to have that equipment and making sure that they were able to be safe during this COVID-19 environment. So I just want to thank you for the time, and we'll be open to answer any questions follow my colleagues' presentation.
Thank you, Mr. Millard. Ms. Shockley, it looks like you're next.
Good morning, everyone. I'm Nancy Shockley. I'm the director of the Community Partnership for Children and Families in Dorchester County, and I am finishing up my 24th year with local management boards. So I've been around a long time in a lot of different capacities. So Dorchester County has been embarked on a mission of building a community to end poverty. The overall poverty rate in our county exceeds both state and national percentages. Most people of color are disproportionately experiencing poverty in the community. And as COVID has hit, that number is growing. The poverty rate for people of color is at a staggering 31% compared to 11% for whites. And we have 27% of our children who live in poverty. The strategy that we've chosen to move from a community that manages poverty to one that is reducing poverty is through the development of a poverty reduction lab. That lab is a community level strategy that draws on all sectors of the community to address the social and economic problem of poverty. Through the lab, we create a community-wide commitment to reducing poverty. We work to raise the poverty IQ in the community, build the capacity of our nonprofits to provide services to those families. A great example of that is we're partnering right now with the Department of Social Services. They had some Families First money that they were doing some training of their own staff using family-centered coaching, which is a program that was developed by the Kellogg Foundation. We actually partnered with them and expanded that training to offer that to our school system, our early Head Start and Head Start families, community action centers, school wellness centers, and some others. So we're real excited about that. We look to analyze our service gaps and our systems barriers and make scalable solutions to improve service delivery, as well as inspire people to really look at long-term solutions. Last year, we embarked on efforts to assess and analyze the causes and conditions of poverty and to strengthen our own human service ecosystem to reducing poverty. Through community conversations, interviews, and discussions with families who live with low income, we deepened our understanding of the challenges they face and how they pursue, the challenges they face as they pursue work and the employer struggles to secure and retain workers. One of the most common barriers that was identified through that process is what is called through our circles work, the cliff effect. That effect is where a wage increase triggers the loss of benefits that's worth more than that wage increase. And through sharing of information with the Poverty Reduction Lab, our community leaders are able to strategize solutions to overcome that effect. So we're continuously working. Equity, as you had mentioned earlier, Senator Washington, equity has been and continues to be a major topic of discussion in Dorchester County. As you all know, we have a tumultuous history when it comes to equity in our community. We've recognized that, and we recognize that to achieve the social and economic benefits of equity, we have to first identify what those barriers are. We continue to focus on the root of the problem, the institutional structure, even however unintentional that is, that works against people of color and those living in poverty. And with the help of many of our community partners and equity experts, we continue to explore the barriers within our systems that are built into our policies and work to challenge the institutional racism and the other barriers that keep our families trapped. So this is a long-range goal for us, but we are committed to improving the overall level of reducing poverty in our community.
Ms. Shockley, I will just say that there's a lot of interest I'm getting about this poverty lab, and so we will definitely follow up with that. So thank you.
Glad to share.
Yeah, absolutely. Ms. Eisenreich, Howard County.
Yes, thank you so much, and thank you for the opportunity to speak with you today. I'm Kim Eisenreich. I'm from Howard County's Local Management Board, and I just want to briefly focus on how our Local Management Board has been responsive during the COVID-19 pandemic on just a few of the strategies that we've employed. So first, we have doubled down on our food access work that we were already previously doing. We, to date, have served over 4,000 meal kits in partnership with our Roving Radish program, which provides healthy meal kits to families and also supports our local farmers. This program specifically provides free meals to families that were falling through the cracks in terms of their inability to access any of the other food resources that existed in our county. And so through that, like I said, we've been able to provide over 4,000 meal kits, as well as an additional 846 grocery boxes that, again, is in partnership with the Roving Radish program. In addition, we have partnered with our faith community and local restaurants to also provide over 1,200 hot suppers in our highest need communities. In addition to food access, we've also focused on supplemental academic and social and emotional learning supports for our highest need students. When the pandemic hit this last spring, we partnered with our school system to provide over 600 supplemental academic materials that focused on math and literacy to over 600 students across 5 of our Title I elementary schools. And we are currently in the middle of launching 4 different sites serving 150 middle school students that will provide in-person support for virtual learning with additional social and emotional learning supports, utilizing 4 of our 50+ centers across our county. And finally, we have also focused on mental health. We have maintained our investments across our local care team, as well as 2 additional psychiatric rehabilitation program and our Building Youth Resiliency mental health program throughout the pandemic, and have continued to invest in those programs. In addition, we have provided online webinars to families to support both how to handle the pandemic, addressing the trauma of the pandemic, and how to support their children who have special needs where they're not receiving the same supports they were prior to, and also how to manage the other pandemic that we all know we are facing, which is the racial inequity that is plaguing our country. And it's a very real trauma for our kids and families, and how to support families dealing with both of those issues that are severely impacting the mental health of not just our children, but also our families as a whole. So thank you again, and we look forward to answering any questions that you have.
Again, thank you. Thank you so much. And again, very powerful work, important work. Thank you. Next, Mr. Wheeler, Montgomery County.
Yes, thank you. Good morning, everyone. Thank you, Chairs Washington and Kelly, for having us here today. My name is Elijah Wheeler, and I have the pleasure of serving as the Executive Director of the Montgomery County Collaboration Council for Children, Youth, and Families, Montgomery County's Local Management Board. Here, as you can see in the PowerPoint, is a rather brief overview of some of our current priority areas, especially in consideration of the current impacts of COVID on our community. I want to just briefly wrap this up today by speaking about the importance of Lmbs, especially in this time. First and foremost, as collaborators, we break the mold. We recognize that the voices of young people are infinite. Young people have a lot of different identities, each representing their different communities, their cultures, and their heritage. It's our responsibility as adult allies to hear their voices and all of their diversity. And when many people say that youth or community voice incorporates everyone, we can't put everyone into the same boat. So it's the responsibility of all of us, especially adults, to acknowledge that every youth and community member is a unique individual, which is why it was important for us as a part of our community needs assessment to make sure that we had a youth-led community town hall to hear directly from the youth, and also to have them actually facilitate it as well. That was extremely important and highly engaging for our young people. Secondly, we're conveners. Bringing diverse people and voices together is imperative. In order to find fresh perspectives and voices, convening also gives us the opportunity to be active members within the communities that we serve. In convening, we effectively create a marketplace for ideas where we can both be a host and a stakeholder. This allows local management boards to revisit our own approaches and reflect on new ideas to drive our own work forward. Lastly, we play a strategic role as being a thought partner, which is integral in the practice of sharing ideas and experiences with others to help them navigate complex challenges. When you pair people who represent different sectors, from county government to community-based organizations together, you work and complement with each other. And then you also stretch each other's view of the situation to find and sort useful new approaches to a problem, which is what we're currently doing during this pandemic. Lastly, while it's important that we consider the immediate needs that we have to address due to the COVID pandemic, we must also consider the level of future planning that Lmbs will be integral in to ensure that our communities adequately recover from the disparities that are currently being exacerbated. So we appreciate you all's support and want to continue to serve as those thought partners within our own local jurisdictions to push a lot of this work forward.
Absolutely. Thank you all so very much. We have a few minutes for questions. I see Delegate Eric Ebersol has a question.
Thank you, Madam Chair. It's so nice to hear the local management board's perspective and what you're working on. I know that counties are responding to a new need that has come up recently, and that is the need for child care for school-aged children. I know that they are cobbling together programs. Howard County, they're called rec zones. Baltimore County hasn't come up with a clever name for them yet. Harford County is calling them learning centers. Some of them are using schools, some of them aren't. But I'm wondering what the level of participation, what programs local management boards and others are able to participate in helping to find childcare for parents who didn't previously expect it. I'm also concerned that parents who now need this childcare probably didn't plan to need this childcare. It may not be in their budget, and they may have to sacrifice something, or they may not be able to afford it at all. And I also want to know if we're doing anything to guard against children being placed in perhaps places where they are either in danger or less seriously, at least with people who are not competent to help them, who are not licensed. And I want to know if anyone is looking at these issues, how we're monitoring. I have a deep fear of children who are 8-year-old and older, which is a legitimate law, being left home for the entire day with a sandwich and a laptop and told not to answer the door. So if anyone can respond to that sort of omnibus of problems that have popped up with children not being in the school buildings during the day, I would appreciate it.
Delegate Ebersol, this is Nancy Shockley with Dorchester County. I can speak to what we're doing in Dorchester County. We've been working very closely with all the community partners, and daycare has been a question that has been raised and a concern that's been raised from day one since the pandemic started. One of the first things that we did was work very closely with our family providers, making sure that they had all the proper PPE and all the things that they needed in place to keep our children safe. They were the ones that were responding to essential workers. What we're currently doing is through some of our CARES money through the county government. I'm a unit of county government. So as part of that, we're working through our CARES money, looking how we can support some of those programs in developing, for example, our YMCA. I'm working with them to develop a program for school-age children called Youth Academy. So it will allow the individual parents to bring their kids in to the Y. They can help them with their virtual learning through the school system and all of those other things. We're also working with one of our daycare centers who was unable to provide that early morning drop-off for our teachers, essential workers, and things like that. So we're working through the CARES money there as well. I'm also looking to submit an application to the Governor's Office on Crime and Prevention Services to support some of these programs through some funding opportunities there as well. So it is something that I think every one of us is concerned about, because you're absolutely correct. One of our biggest concerns is that these children are being left home alone. We're also working with, in one of our forest communities, New Beginnings Youth Center, on developing an opportunity for virtual learning during the day, and then potentially after school services as well. So I think we're all paying close attention to that.
Let me just follow up, Delegate, and try and give you a statewide response. So local management boards play this role of trying to coordinate, and it has become so important during COVID because everybody's concerned, just like you. And so childcare has been a huge issue. And what's happened is things have popped up all over the place because that's the new behavior now in COVID. So the wild pop up with a program here. In our county, we had a group of churches who created 8 different learning pods. What becomes important is how to coordinate that so everybody knows that it's happening, and then to get the information out to parents, and then to address the other issues. And the funding then, how do you braid together funds with county government, etc. So I think you could talk to all of our colleagues on this panel and extend that through the 24. They would all give you a different answer of how it's happening, but I can promise you, every single one of my colleagues is trying to figure out and coordinate this so it works best for the children and families we serve.
And I would just quickly add that our biggest concern is also affordability. So, you know, we know that our school age families are not budgeting for childcare costs in the same way that that families that have early childhood maybe have that, you know, be budgeting for that. And so the pandemic has thrown a huge budget issue to so many of our school age families, including our ALICE populations that oftentimes fall through the cracks and are not seen. And so in Howard County, we are working on providing another layer of subsidies for families to try to support our school age families, as well as our office is specifically providing a middle school in-person supports, because again, we are worried about our middle school students being left at home by themselves to manage their virtual learning alone, which is very difficult to do. And then we're also providing support to our childcare providers, because they have also been hit economically by the pandemic and are struggling to stay open. So it's really a twofold issue, both on the family side and the provider side. And we're trying to address the affordability issue, in our county, but I know that that's an issue across all 24 jurisdictions.
Thank you. Absolutely.
And I'm sorry, Madam Chair, if you wouldn't mind, I just wanted to lift up, in May, the Maryland Family Network did a landscape analysis. And what we understand is that in terms of child care providers, that we're at risk of losing at least 51% of our licensed child care providers, which I think is important to reference that. And then also when we're talking about equity, this is a key equity issue for us specifically not only statewide, but also in Baltimore City, where you have parents who are of means are able to have temporary solutions such as nannies, such as tutors. But then, of course, with those families that are considered to be essential employees, do not have those resources. So we are working with our Early Childhood Advisory Council, which we house as an LMB, to make sure that we're able not only to get a clear understanding of that landscape, but also to make sure that we're able to advocate specifically using data to tell that story for resources and support.
And I want to thank Delegate Ebersol for raising this broadly. If we don't have a supportive aspect for our families in these virtual learning environments and plans to ensure the public safety, if we don't have a supportive aspect, that is counterproductive. And so thank you for that. And childcare has always been a priority for this committee and will continue to be so. I see Senator Sidnor has a question, and then we'll need to move on. And if there's other questions or comments, either put them in the chat or we'll get back to it later.
Thank you very much. The poverty reduction lab that was mentioned in the presentation that Dorchester County has, I'm wondering, is it unique to Dorchester County, or is it something that many labs across the state have?
So I will say that every single local management board is concerned about poverty, because we know that all of the things related to poverty cause all of the other pieces, all of the trauma, and all of the other effects are all part of that poverty. We've all done it in a different way. The wonderful thing about local management boards is they work locally with partners locally to figure out local solutions. So whereas Nancy has got a poverty lab, my agency has communities of hope all over the place. In Montgomery County, it's a different format, but every single local management board understands that poverty is where a lot of the economic issues, where a lot of all of the other pieces that impact the likelihood of a child's success begins. We've always been a prevention model. We've always tried to figure out how to get in as early as possible to address those issues. But every single one of us is addressing poverty in the way that works best in our own community.
Thank you.
All right, thank you. Thank you all. Next, we're moving to our local care teams, again, which is we're very interested in hearing from your perspective. We have Deidre Berry from Anne Arundel County, and we have Mary Leslie, Baltimore County, and Jan Willis, Talbot County. So Ms. Berry, if you could start with us today. Thank you. And then colleagues, don't forget to lower your hands so that I know.
Good morning. I think,
well, oh, sorry. It looks like we have okay.
I think I'm starting because I'm going to give you an overview of them. So I've got 2 more slides.
Oh, okay. So make it
really quickly, Senator. I promise. I'm on it. I'll do it quick. So local care teams have been around for a long time. It started with systems reform back in the 90s, and then legislation got brought in 2011. And the whole point of care teams is to try to pull together all of the different disciplines to be as helpful as we can to families, to provide the community resources and services that will stop their children going into out-of-home care. So it really is a very preventive model. And so when the care management entities were discontinued in 2015, the state looked back and said, you know, those local care teams that we tried to create in the 90s, they weren't a bad idea. And this new legislation came in that basically said, for children with intensive needs who were served through multiple agencies, you know, might be dealing with DSS and the health department, we need a team of people who do the work to sit with families and try to help them with the community resources so that they're not having to wander around to this agency, that agency, and the other, but that we can all talk together. And so we recreated local care teams, I think it was about 4 years ago. And we could go on to the next slide. Next slide, please. Oh, maybe that was the first slide. Maybe it's, there we go. So they meet regularly in every jurisdiction. We have 4 care teams just in our county, and some of them meet twice a month. We have an early childhood care team. We have a homeless care team, which is called Bricket, Bricks and Mortar Cricket. We have an aging care team, which is called Silver Cricket, and then we have a regular, so all our teams are called cricket teams, but they are care teams, and we also have just a regular care team. They consist of state and local agency reps, child serving systems, and not-for-profits sit at the table. They're a place where families can come and talk and be partners and not feel like that they're having things done to them, but they can talk through their issues. It's a great way to blend funding and resources. Sometimes I think it's a bit like horse trading. We'll find out that a family has mental health issues and we have to figure out, well, should this be the mental health agency because they've got targeted case management? Should this be in-home services at social services? Should it be one of my navigators who do a sort of case management light? All of that blending of funding and resources happens in partnership with the families. And that's what's so important about the work. We also, by statute, have to discuss all the requests for voluntary placement that run through social services. And our role in that is to try and figure out if there are any community services available that would make that less likely. And so we do that piece as well. Our referrals come from all the child serving agencies, a lot from pupil personnel workers, but we also have families who self-refer. Again, the family is a partner, and that whole coordinating of that happens through a care team coordinator, and you're going to hear from 3 of them this morning in every agency in the state. I will say that the care teams in Anne Arundel County won the Excellence and Innovation in Government Award from MACO last year for our care teams. So they really are well regarded, I think, in each community.
Thank you. We're going to change the order a little because we have a hard stop for one of our panelists. So Ms. Willis is going to go first, then Ms. Berry, then Ms. Leslie. So thank you so much.
Great, thank you. I don't know if my slides are.
Here they come.
Wonderful, fantastic. I want to thank you for this opportunity, and Pam, thank you for that overview about local care teams. You can go to the next slide. So I'm from Talbot County, and I have been serving as the local care team coordinator since March of 2018. Prior to that, I was the local management board director here in the county for many years. And so I wanted to start with data, some numbers here. And so you'll see that we averaged about 2 cases to the local care team in 2016, 2017. And then when we started to receive funding from the Children's Cabinet in 2019 and up to 2020, you'll see that because we had that dedicated person as the local care team coordinator, that we were able to do education and outreach and reach so many more children and families. You can go to the next slide. So in Talbot County, we're a very small county, and our local management board is structured a little differently. We are not employees of the county, but we're contractors with the county, and that extends down into the local care teams as well. So as I mentioned, I started as the local care team coordinator in 2018, and I work about 10 hours a week at this function. So I provide leadership, facilitation of the meetings, creating the scheduling, providing outreach and education to parent groups as well as clinical groups, and then provide tracking and follow-up with the referral sources and the families. And the other function of the local care team was to make sure that there was a full and rich resource directory for parents and children in the family. And so we've split off that function to someone that can focus on that in a more administrative capacity and fulfill that as well. And that is Erica Horner with Healthy Talbot, and she works 35 to 40 hours a month in that function. So next slide. So I loved what Pam said there, is that we work in partnership with families. We keep our care team kind of lean and mean so as to not intimidate families as they come to the table. We are a resource for the family. We're not experts telling them what they're doing wrong or how to do things. That'll turn a family off right away. We center on the family's goals, and we work to meet those goals, help them meet those goals, and then we introduce other goals that we see as, working with a family. So we work to identify the right service, not just throw a bunch of services at families. That doesn't help anyone to overwhelm a family. It's matching the right service is the best thing. I will say that during COVID-19, we actually found, I was a little worried about that transition to video conferencing with families. And let me tell you, I think they might like it better. I don't know that we'll ever go back. They find it as a convenience that they're not having to travel or find daycare. It's much less intimidating to talk to someone like this versus coming into a room where you have a room full of experts that you have to sit down with. So we're finding they're very responsive and family friendly. So I was very pleased with that. Next slide, please. So you wanted to hear a little bit about partners, and I'll tell you, it's a little unique here in Talbot County and probably the smaller counties across the state, is that because we're kind of lean and mean in the county and the services that we have to work close together. And so we have great relationships. So we have all of the mandated partners at the table for our local care team. Plus, we add a few additional CASA, the school-based mental health providers, Maryland Coalition of Families, and Wraparound Maryland are there. And then, based upon what family is coming to the table, we might invite other partners. But again, we like to keep it, usually between all, that still reaches about 13 people around the table or little boxes on the screen, so to speak. And that can get intimidating. So we want to make sure that we're not just throwing a bunch of services out there, we're getting the right services for the family. And so over the last 2 years with the LCT families, we've been able to connect families with over, I did a quick tally, over 40 different services. And so that's a broad range across the county, from behavioral to physical health programs to mentoring, employment, food, you name it. That's the nice thing. I always tell families when they come in, this is your opportunity to pick a bunch of brains. We're here to brainstorm with you, not tell you what you need or make judgments. We're in partnership with you. So, and then the LCT partners at the table are assigned responsibilities to assist families. And it's my job to make sure that everybody's doing their job, so to speak. So I'm following up with the partners to say, did you get that application back? Have you done this? And making sure with the referring partner that things are progressing along. And we all assess together to decide, do we need to bring this family back to the table for further review and assistance, or are they doing okay right now? Next slide. So we serve some other functions too. As we're all together at the table, we're building stronger partnerships, and we're finding other ways to partner with each other. We're identifying trends that are happening. Over the last 2 years, we've seen a statistically significant number of families with children that were adopted at the table, and in particular, interracial adoptions. So then we're identifying training opportunities to how do we make sure that our providers in the community, particularly mental health providers, can address these needs? How do we sensitize everyone to the needs and make sure that we're addressing those? And of course, always sharing. We're always resource sharing. Next slide, please. During COVID-19, I'll just finish up with, we missed one meeting in March because our meetings fall at the end of the month. But we quickly started meeting again in April and had made up an additional meeting in April to make sure that we were reaching those families. During that interim where we didn't have a meeting, I was reaching out to everyone and making sure that families were getting the resources that they were needing. And so referrals, as they came in, were getting close attention by myself and making sure that we were making connections even if a meeting had not occurred yet. We did have one case early on, I want to say in April, of a family needing a higher level of care, a 90-day diagnostic. And this was a family that had used more intensive mental health services in the past. And phenomenal mom and parent doing an amazing job advocating. And it was, we put in some additional services, and still the parental stress and having no break for this single parent, I think, compounded. And I will say, gladly, he is returned home and doing well. And we've had a follow-up meeting with that youngster. And so I think it's a win there. So families just working with partners to help modifying programs a little bit and help programs see how they could still serve families quite effectively in a virtual format, on the phone, in the yard, safely and helping families. And another duty that I picked up during COVID is that we received, the local management board received a call from the Emergency Operations Center, and they needed someone to direct the food working group. So over the last, however, I've lost sense of time here, last however months this has been, we have worked to provide over 300,000 pounds of food to families in Talbot County. So that's it.
Yeah, and there's so much you've done, and we're going to be doing so much more. Thank you for your work in Talbot County. Next, we're going to hear from Ms. Deidre Berry, Anne Arundel County.
Good morning. So as Dr. Brown stated, all LCTs across the state act as forums where families can plan in partnership with a cross-agency team of professionals. In Anne Arundel County, we actually have our local care team broken down into 4 teams, 3 of which fall under myself in terms of local care team coordination. We have our Cricket team, which stands for Community Resources Initiative Care Team, and referrals that come in are for families with intensive needs that need help accessing resources. Like all LCTs, families are given an opportunity to have all the agencies in one place. They can ask questions and receive direction from members of the team within a family-friendly environment. So families are always made to feel comfortable and they can express themselves, their fears and concerns. We have our EC Cricket, which is Early Childhood Community Resource Initiative Care Team. And that's for families in need of assistance with children that are 5 and younger. BRICK is for families experiencing homelessness. That stands for Bricks and Mortar Community Initiative Team. Prior to March, both Cricket and EC Cricket were held twice a month in person, one in our office in Annapolis and again at the community college in Glen Burnie. The same applied for EC Cricket, with families being heard twice a month at 2 different locations. Bricket is typically held once a month and is scheduled as referrals come in due to its more urgent nature. prior to the pandemic, we were seeing 2 or 3 families at each meeting. And since March, we've been seeing between 4 and 5 each time. So we're definitely seeing a significant difference in those referrals coming in. Obviously, Brickett has a definitive nature. Families are coming to the table because they're experiencing homelessness. However, since the onset of COVID, it's also important to note that since March, even the regular cricket team has heard a heightened amount of cases with issues that extend beyond typical cricket issues, like mental health or education, substance use, and have included huge financial constraints regarding utility bills, food, and general living expenses. In terms of numbers, over the last fiscal year ending in June 2020, there were 59 families reviewed by the regular cricket team, 21 reviewed by EC Cricket, and 29 reviewed by Brickett. Since the onset of COVID, each team has maintained consistency with meeting schedules. We now hold them virtually, and as Jan said, it's been very successful, and I agree that most of the families prefer being heard virtually. We didn't skip a beat since the onset and jumped right into being virtual. We didn't miss any meetings. Even though, despite the lack of in-person services during COVID, we have still been able to prescribe services that are beneficial and fill the gaps needed during this pandemic, with a lot of assistance from our systems of care team, which is comprised of family navigators that are able to further help families navigate through the various agencies and teams that sit on our cricket teams, and with resources that were suggested to them through DSS or DDA mental health, and a very large selection of other providers and state agencies.
Great. Thank you. Thank you so much. So now we're going to hear from Ms. Leslie, local care team, Baltimore County.
Good morning. My name is Mary Leslie. I'm a local care team coordinator for Baltimore County. I'm a staff member of the Baltimore County Local Management Board, or LMB. Our LMB is a part of the Department of Health and Human Services within Baltimore County government, and we serve as the administrative arm for the LCT. It was mentioned earlier about the number of people that sit on our team. We are mandated by law to see have a number of people on our team, and I would like you to know who they are. We have a representative from the Baltimore County Department of Health and Human Services, which serves as our core service agency. And for cases involving substance abuse, we also have a professional from that agency attend the meeting. Another required member is the Baltimore County Department of Social Services. And we actually have 3 folks representing DSS on our team, one from Placement Resources and Support Services, a supervisor from Family Preservation, and the VPA, Voluntary Placement Agreement Specialist in our county. Of course, the LMB is a member, and I represent that for the LMB. Baltimore County Public Schools are represented by 2 different folks, one from special education and one from pupil services. We also have a member from DJS, the regional office for Central Maryland, sits on our team. We have a representative from the Developmental Disabilities Administration, the regional office. We have a representative from the Baltimore County Department of Health, and she is a public health nurse. We also have our family navigator sitting on our team. She works for our LMB Family Navigator program. And finally, we have a mandated representative from DOORS, the Division of Rehabilitative Services, who are required to attend meetings for kids who are 16 or older. What makes us different from many of the other LCTs in the county is that we have merged with our local DSS multidisciplinary case consultation team. You may know them as multi-Ds, or you may not know them at all. Yes. What they were and continue to be within the LCT is a long-standing interagency committee that provides consultation, advice, and suggestions to referring professionals regarding complex places with family and children situations in which there are multiple families involved or the need for multiple family involvement. There are issues and problems facing the child and family that exceed the normal scope of any one agency, and or there is actual or potential child abuse and or child neglect. Many of the former multi-D members were actually members of the LCT, So as such, we decided that in Baltimore County, we were going to actually merge these teams in order to better serve families. Also, I'd like to know about a typical LCT case. These involve youth with intensive behavioral needs. And some of those primary behaviors are aggression toward family members, staff, and peers, suicidal and/or homicidal ideations, refusal to engage in services, refusal to attend school, AWOLing or running away behaviors, and substance abuse. As you might imagine, families of youth reviewed by the LCT are often completely overwhelmed with their child's behaviors. To address these issues, the LCT uses a coordinated interagency approach with the overarching goal of preventing out-of-home placements. We do this by providing a forum for families and children with intensive needs to receive assistance with the identification of potential community-based resources to meet those needs. We facilitate interagency discussions and problem solving for individual, child, and family needs. Families are referred to available community resources and to care coordination when appropriate. We provide technical assistance to local agency and community partners, and we discuss all requests for DSS voluntary placement agreements per law. Lastly, we review out-of-home placements of youth who require out-of-state placements prior to referring those youth to the Interagency Placement Committee of the Children's Cabinet. The LCT strongly encourages parent attendance and active participation in our process. They often attend LCT meetings and by phone or in person. And since the start of COVID-19, we have been able to continue all of our meetings, and we've been conducting them by conference call. And the reason we do that is that some of our agencies don't have laptops with cameras. So anyway, since the LCT, the LMB, excuse me, is the administrative home for the LCT, parents, guardians, family members, LCT member agencies, professionals in the community are able to make referrals directly to the LCT through my function as the LCT coordinator. I work closely with staff from member agencies and offer assistance regarding case coordination. During LCT meetings, referral sources are able to seek assistance with assessing services, developing plans of care for community-based services, and coordinating services for multiple agencies. During FY20, the Baltimore County LCT reviewed 42 cases. Thank you for the invitation to speak this morning.
Oh, thank you. And thank you for all your this work. Your Senator Stallings has a comment. Is this for the whole group, or Senator Stallings, are you?
Well, can you hear me?
Yes, I can. Yes, we can.
Can you hear me?
There you go. There you are.
Thank you so much. Okay, I want to thank all the local groups that are doing all this hard work, and I know it's a struggle right now in this time. But I like to ask Mary, I want to thank you for all the information in Baltimore County, and I'd love to get the contacts, if it's possible, that we can also have those. And if we get the people that will be calling our office with this, we would love to have that contact. And Mike, always what I've heard when we were just in legislation this year, people that are going out state, not staying in state. And I know it's a very major concern with some of the parents, but also for kids that are homeless, in our school kids that are homeless. I want to see what more, if there is other things we can do to.
Yes, sir, of course. You would like a list of the LCT representatives, is that correct?
Yes, thank you.
Yes, I'll make sure you get that. Also, regarding out-of-state placements, I think the reason for those increasing has been the level of aggression that we've seen with our youth, which has really increased. I've been a member of the LCT for 17 years. Before that was called the LCC, the Local Coordinating Council. At that time, we reviewed every child that went into an out-of-home placement to a residential treatment center, in-state or out-state. We don't see all the kids that go out of home at our LCT. We only see those that are referred, that are required by law. And that's another reason we merged with our multi-D, so that we could actually try and prevent some of these places at a lower level before these kids get to the level of needing a residential treatment center placement. And regarding youth who are homeless, we really have very few cases that come through the LCT of youth that are homeless. We do have an initiative in our LMB called for unaccompanied homeless youth. We are providing case management services for those youth through funding from the Children's Cabinet.
Okay, well, thank you. Thank you.
Thank you so much.
That help you. Also, Senator, you might just stop your video. Sometimes that helps with the streaming. So there was a little bit of buffering issues there, but thank you. Are there any other questions? I know that there was a member was concerned about food pickup. And yeah, so it was a little concerned about how you're coordinating with the school systems. And this could just be a short answer, but I think for a longer interest we have is that how are we coordinating with school children to pick up their food for working parents? And this, again, dovetails onto what Delegate Ebersol was talking about, and some of the vulnerabilities. And then I guess we could also maybe touch base with what Senator Heddleman mentioned. You're seeing you're rising in the level of violence, degree to which we can address the mental health issues that are being introduced or exacerbated by COVID. But just a quick answer to the coordinating with the school systems around.
We've all been coordinating with our school systems
about that.
Yeah, we've all been coordinating with our school systems from the beginning. They took over the sort of daytime feeding of children, and depending on your school system, they applied for waivers so that they could feed more than what they usually serve. So what local management boards did was fit into all of the gaps where school systems were not serving. Sometimes we served alongside them, sometimes we did it at food pantries, but we're always a sort of gap group. So we let the agencies do the work, we want them to do it, but where we see the gaps, that's where we go in.
So we're going to jump real quickly to the Youth Services Bureau. I'm sorry, maybe we can bring you back and do a more deep dive, but I want you to give your presentation. And colleagues, I know some of you have a hard stop at 12. We'll probably need to take this to 12:05, 12:08 in fairness. But Senator Eckert wanted to extend her deep presentation for all of you. She also has a hard stop at 12 for all of you that are working on the front lines for this emergency times, especially in the Western in Dorchester County. So again, thank you. So Ms. Park, if you could talk with us for a few moments, we'll get some questions and then we'll wrap up.
All right, thank you so much for allowing me to speak to the committee about youth service bureaus. And I will be quick. A lot of the things that I was going to speak about has already been spoken so eloquently before me regarding the need for support, especially financial support for all of these programs and the Lmbs and the cuts that they've encountered, even recently the 10% cut, which meant kids weren't going to get services. So just real quick, for those of you who don't know what a Youth Service Bureau is, we are in COMAR under the Department of Juvenile Services, and we're mandated to provide delinquency prevention services and mental health services to families to keep kids from going deeper into the juvenile justice system. I'm going to add to your list of legislation that I know Emily and Ann presented was last year, the Youth Service Bureaus put in Senate Bill 49. It was House Bill 709 to designate funding for Youth Service Bureaus. And again, the idea being that every year we face funding cuts. And so we were looking to have some designated funding for these programs so that we could expand youth service bureaus across the state. So I won't go deeply into that, but it kind of goes to Mr. Fuston's point about finding that stable funding for these programs so families and children know where to go to get the services that they need. We, like everyone on the panel, has seen an increase in mental health concerns, especially since COVID hit. Working with our families through telehealth now, through Zoom and other ways to provide those direct services in their home. But we are seeing, you know, the increases in the anxiety, the depression, suicidal ideation. We're doing groups, online parenting groups, youth groups, to try and address these services via Zoom. But like mental health services, sometimes you need to be in the room when somebody's suicidal. And so we're looking forward to when we can get back in the room with our kids and our families. But all of those changes require adjustments and funding. So we, again, just urge that, and we know you all support that, that's why you're on this committee, that we continue to urge the state to increase funding for local management boards and children serving services so that we can all have successful children in our state. So I know you're on a time crunch, so you have my written testimony, and I just wanted to make those few quick points.
Again, thank you so much for that. And do members have any questions or comments that they'd like to share? I know that we are facing difficult financial and fiscal times. And I know the members, we are going to be making some really difficult decisions. And so I hope that what this committee can provide is the proper information so that the reductions that we need to make are targeted, and then we understand the full implications of blank cuts, 10% cuts to something like local management boards or the youth agencies, and then to figure out how we can support these services. Again, I want to thank everyone for being at this meeting. I want to thank our guests, our panelists. Again, you do so much good work. We just can't thank you enough. I want to thank your committee members. You see that the task before us, it's always been challenging, but especially in light of COVID, and especially with our economic and social crises that we are addressing, but also the enlightenment that we now have to equity, to race equity, to economic equity, that we make sure that services that are provided to children, youth, and families in Maryland are what they need to be. On behalf of Delegate Kelly, who had to, I believe, had to leave, we're inviting you to our next meeting, which is October 8th. I'm not sure of the time yet. It may be at 1 o'clock, but you can find the list of all of our hearings and our meeting times on the Maryland General Assembly website. If there's a question you feel that wasn't answered, please email our offices. We'll do the best that we can get an answer for you. Again, thank you so much, and have a great afternoon.
Thank you.
Thank you.
Meeting is adjourned.
Thank you.
Thank you.